One of the worst things you can hear when you're battling cancer is that medicine to help you in that fight has been backordered. Unfortunately, that's what lots of people across the country are hearing.
Yeah, tonight I'm sharing the story of a woman in Swansboro who waited months for her prescription to be filled, and to experts about just how widespread this issue is. Linda Van Dyke is many things: a gardener, an ocean lover, and a woman of faith. She's also a lung cancer patient. Her journey started a decade ago.
At the end of 14, I got to where I could hardly walk. And if I got to a squatted position, I couldn't stand back up. St. Patrick's Day that year, I was laying on the table and they were cutting my lung out.
It's impacted the way she lives her life. Right now, Van Dyke takes Octiro, a chemotherapy drug, but the side effects are rough.
It depletes all the water in your body, so your bones, everything is hurting.
To help her with the pain and lack of appetite, her doctor also prescribed dronabinol back in February, but months later she was still struggling to get it filled.
I've called the Walgreens here in Swansboro. I called the Walmart in Swansboro. I called the Duke Cancer Specialty Pharmacy, and they couldn't even get it.
Finally, in June, she found out it was ready.
It doesn't take the pain away, but it helps.
Pharmacist Sarah Miller says dronabinol has been on back order for the 2 years she's worked in the business.
We've had a few prescriptions come in every now and then, but I haven't been able to dispense it.
She says there are a lot of factors that can make a medication be back ordered.
Sometimes it could be there is an ingredient in there that's on shortage that is making the medication on shortage.
The last thing you want your patient to be dealing with is the stress about not being able to get access to these drugs that are potentially life-saving.
Duke gynecologic oncologist Angela Alvarez Secord has worked alongside other oncology experts to help doctors navigate shortages.
In over 30 states, our colleagues were experiencing drug shortages that were affecting treatments for their patients. So that's how this really launched. It essentially was like a house of cards. There's so many issues in terms of you're getting raw materials from countries outside of the United States, predominantly China, then developing these active pharmaceutical ingredients, and again, predominantly ex-US countries. And so we're reliant on those, and we can't always assure quality control.
On top of that, when drugs are generic and less expensive, Dr. Secord says that can decrease the profit incentive for manufacturers.
Until our representatives in Congress put some real legislation behind this, I don't think it will be solved. It's not a simple, the FDA should take care of this. They don't have the ability to do that. This is on so many levels a system that unfortunately is broken. It's not working.
For Van Dyke, she's grateful that she's no longer waiting for her prescription to be filled, but she's worried for those who are, and hopes efforts like Dr. Secord's continue so that no one has to wait for a drug that has such a significant impact on their life.
It's just unacceptable.
And Dr. Secord says the best way for all of us to help fight drug shortages is advocacy. You can start by talking to your legislators about the importance of addressing shortages of oncology drugs and all drugs across the board.